So thank you for joining us again for our last session. On behalf of the Conference Planning Committee, we thank you for attending. So I am Dr. Yvette Conyers. I'm Clinical Associate Professor at the George Washington University over in DC.
Dr. Celia McIntosh, working in neuroscience at RGH.
And we're here talking to you about addressing the mental health crisis, how DMPs are preparing mental health first aiders to bridge the gap. Our objectives, I'll leave them up 5 seconds. I know you can all read that. And so what I want to talk to you about is what we know nationally to start. 20%. 20% is the number of high school students who reported serious thoughts of suicide, and 9% have made an attempt to take their lives. Suicide is actually the second leading cause of death among people ages 15 to 24 in the United States. Second. And then in 2020, there was a huge trend that accounted for 14 states had an increase in suicide attempts and suicide successes. Huh? Oh, sorry. I'm advancing it on my laptop and not up here, y'all.
Oh, give me this.
Okay, thank you. You can go one more. Mm-hmm.
Right?
Yep, one more. Other way.
Oh, wait a minute, where are we going? Which one?
Other way. Keep going, too.
Okay.
Yep.
Okay.
90%. So 90% is actually the number of practitioners that identify as non-Hispanic white. But we know, according to our United States statistics, that 30% make up racial and ethnic minorities. There's a disproportionate amount of, people there. The lack of diversity in the mental health field means that there are ambiguous implicit biases and few opportunities to be challenged and dismantled. Increasing the diversity of those trained in the curriculum I'm going to talk to you about, specifically about mental health issues, can empower nurses to engage and guide help to break down the mental health barriers in our community. What we know locally, so this is specific to Monroe County, Rochester, New York, where we previously resided. 8.8. 8.8 was our county suicide rate. So I mentioned 9%, meaning the national, so we were under the national, but we are definitely higher than New York State, which is 8%. Adolescents and teenagers often experience increased mental health stresses that go unnoticed or untreated. We know that the pandemic only increased this. 28%. 28%, again, Monroe County, specifically of our public high school students, felt sad and hopeless over the previous 2 weeks that affected their usual activities. That was in the previous year. And then 44%. 44% of those studied reported they persistently felt sad or hopeless during the past year, and these are among our adolescents. And then more than a third, 37% of high school students reported they experienced poor mental health during the COVID-19 pandemic. Y'all think these numbers are increasing? Yeah. And so what we want to talk to you about is something that we implemented, and there was 2 phases to this, and I'm going to spend time talking about the first phase of this approach. And so in the fall of 2019, and this has been a long time coming because of the pandemic, we determined that there was a need to increase, again, I showed you the statistics and the numbers who are racially, ethnically trained in providing culturally competent and culturally congruent mental health. We know that there was a need in our community. There was the Greater Rochester Health Foundation, GRHF, put out calls for grants. And so we applied as an organization after doing a needs assessment, after looking at our population served, which was our youth, looking at the long-term impact, obviously coming up with a project description, and then our intended results. We received $12,540 as an organization, which I'm the president of the Rochester Black Nurse Association, a chapter of National Black Nurse Association. We received over $12,000 for a grant between June of 2019 and May of 2020. And with that, we were able to train 8 nurses to become youth mental health first aiders. I'll talk about the curriculum in a minute. After, obviously, COVID impacted from the spring 2020 all the way up to summer 2021, 4 of us then became instructors so we can do train the trainer. Because the goal of this wasn't just to get to the youth, those trained. We wanted to then teach people who look like us, right? So then they can go back and filter out to the community. Obviously, we were trained by 2 white women, right? And so that was a big barrier for us. Like, here we are as nurses who are Black and brown people of color, and now we were being trained by white women, but we knew that was going to change soon. We collaborated with stakeholders in order to continue this training. And so the methodology. The Youth Mental Health First Aid course, and if you Google it, you can see it, it really looks at common mental health challenges for youth. Now, this is a curriculum not necessarily for nurses, but just for lay community people. It reviews typical adolescent development, as well as teaches a 5-step action plan called ALGE that I'll go over in a minute, to recognize youth who are in crisis and youth who are not in crisis situation. These are some of the topics that they covered there, but it really helps to inform adults about common mental health concerns among the youth, and again, teaches adults, even just community adults, as parents or those who work with youth, about those common mental health issues and substance abuse. And this curriculum helps to reduce stigma as well. And then ALGE. So ALGE is the phenomenon that's used, or the term that's used to help us with a step-by-step action plan that we encourage our adults to use with our youth. A stands for assessing the risk of suicide or harm. L is for listening non-judgmentally. G is giving reassurance and information. E is encouraging appropriate professional help. And then the other E is encouraging self-help and other support strategies. Now, it's important to note that this is not a linear step-by-step action plan, that it can be very cyclical, and at any time when we are engaging with youth, we may be listening at one point, and then we may be going on to encourage self-help and support strategies, right? So it's not a linear approach, it's definitely cyclical. And then Dr. McIntosh is going to take some time talking about phase 2 of this.
So when we really, started getting the idea of writing, we wanted to write a grant to do more with our community. And the organization that we wrote the grant to basically said, hey, you know, they weren't going to give us the grant initially, but they wanted us to collaborate with another organization and partner, because that organization also had some of these challenges that they wanted to address. So what were they saying as community leaders? They were saying that they were seeing a lot of behavioral outbursts in their population that would come to their center. And this is the Boys and Girls Club, where they actually had a mass shoot. Well, it's not really mass, but it was still a shooting there where 3 of their participants or attendees that came there got shot right in like the parking lot. So they, and staff even, you know, once we got in and started talking to staff, they were talking a lot about PTSD. But other things, they were talking about lack of coping mechanism and the ability to articulate their feelings. The students didn't really know how to open up to them, tell them what was going on, and that's how they were responding behaviorally. And then, of course, the lack of awareness of resources in the community, they didn't know where to go. They didn't have a list of Black and brown providers, but they just really didn't know who do we even reach out for situations like this, so they really wanted this partnership. And then, of course, staff lacking knowledge and capacity to support the youth they were working with. They didn't feel like they were equipped because they didn't have the tools. They couldn't spot mental illness. They didn't really classify it as that. They just felt like these kids were just acting out. Okay, so the project purpose was basically to implement and evaluate evidence-based course to help youth in crisis and non-crisis situations. And then, like I said, it was, you know, Boys and Girls Club, 13 Boys and Girls Club staff and group coordinators, and then, of course, we implemented a youth mental health framework. And the Boys and Girls Club basically provides a fun, safe, affordable place for kids to connect with others and engage in enriching their after-school program. So we implemented the YUP project, basically Youth Uplift Project. We spoke with the stakeholders, like I said, the grant funders and the program director of this organization. We obtained the grant, and then we did a blended course. We basically gave them some pre-work so they could sit in class for less time, which was 2 hours, and then class time was about 4 to 6. And it also lengthened because of a lot of the questions that they kept bringing up. And then, of course, we did an evaluation specifically for them, but then just evaluating on us to, you know, what things do we need in those spaces and how can we move the conversation along so that we're still delivering the content, but also also responding to some of the questions that were culturally relevant that were not basically in the curriculum. And then, of course, we provided breakfast and lunch and those things. So in the evaluation piece, some of the staff that took the course basically said they verbalized the need for self-care. A lot of them, as a part of this, we also have them do like a self-care to write down what things that they do for self-care. And a lot of them didn't have anything. They, so they always prioritize everybody else in their family, everybody else in this program. So they were a lot of them were stumped to say, I don't know, or their self-care included things that they did for other people. So there just seemed to be a need for that. They found this class very helpful for them, but also for the youth. But they also had some of them had some conflict in how they would respond. Because I think one of the questions were like, if someone came to you and said this, how would you respond? And you're like, I don't agree with with this behavior. And they wanted to say that. And we were like, oh no, you gotta have to tweak it a little bit. So those were some of the things that held us up because we had to, they want to be authentic in their approach, but it was like this curriculum didn't really allow for that. And then, of course, this class better equipped them to approach the youth in the centers. And even I think one of the staff talked about how this also, they recognized that their parents were suffering too. The children's parents were suffering. So with this, in just this short time, they were able to notice that. So in terms of changing the game, especially as DNPs, we can utilize our essentials, clinical scholarship, and analytical methods with the EBP. Basically, this is an evidence-based program. So this is one of the things that the evidence is already out there. It can easily well be translated into practice. And then, of course, interprofessional collaboration and improving patient or community outcomes. We're improving population health outcomes. If we are able to have these staff be able to recognize these signs, they can get these youth into the care that they need quicker, okay? And then, of course, interprofessional collaboration. We're, DNP nurses talking to community staff, talking to funders that are going to be able to fund these programs. And then, of course, clinical prevention, population health for improving the nation's health. Like I said, really, being able to, this program really speaks to a lot of that, because if you can, address these issues up front, once you start seeing them happening, then you're gonna decrease some of the outcome of that. One of the biggest things also, youth and staff was worried about police involvement. So we were able to talk about that and how that would impact them. So really being able to have these tools up front to really see that spiral happening was beneficial in the back end, okay? And then forging new paths, implications for DNP. Like I said, really this program in itself, with the tool, what we know is that we can lead population health promotion and improvement. We can influence health policy. There's a lot of mental health bills out there for that we can advocate for. And then assist in probably writing as well, going to Capitol Hill, those things, improving population health and addressing these social determinants of health. And then, of course, forging partnerships, networking with your communities, and then really being to engage them around promoting health. And then, of course, leading community organizations. I'm also the vice president of the Rochester Black Nurses Association. And then, just leveraging these positions to also talk to our elected officials and just other larger executive directors in different communities, and then influence community change. And I didn't know if you want to add anything, but these are our references.
Questions?
Oh, where's that mic? Okay. Oh, she's at. Okay. I'm gonna switch.
Hi, not necessarily a question, but a comment. I like what you said about health policy. I did my master's in health policy, but I would encourage everyone to get to know their legislators, where they live. I've been able to testify in the Maryland General Assembly on a few bills, and they like to hear from nurses. Use your voice, be the voice for the voiceless. Also join your local nursing organizations, such as these ladies. I'm currently the vice president for Maryland Nurses Association, and we have a legislative committee, and on that committee, you have opportunities to testify on different bills. So I just strongly encourage that for everyone to be the change that we want to see.
Thank you.
Any other questions?
Earlier, there was a question about the PHQ-9 implementation. I also can have that. The PHQ-2 is 2 questions, and the first question is not a question for, arbitrarily. It's actually an important question. Loss of interest and things generally is actually very, it's a sensitive and reliable tool. A lot of primary care is now implementing PHQ-9, by the way, as well. At least mine does.
Yeah, and if we think about that concept of loss of interest with these youth, they did mention some of that as well. Like if someone previously was kind of well-behaved and now they're withdrawn, not interacting with you, they would see that kind of behavior too. So this would even help them in that to say, oh, wow, this is probably what's going on with them, and this is why we need to pay attention to these issues, because youth are going to manifest their behavior and their moods differently because oftentimes they don't have the language to articulate, like, this is how I'm feeling.
All right, if no other questions?
All right.